Peta. I'm a student paramedic. What's your name?
My name's Jessie.
Oh yeah, and how old are you, Jessie?
I'm 19.
You're 19. So what I'm going to do today is I'm going to do a respiratory assessment on you.
Mm-hmm.
Is that alright?
Yeah.
Cool. So can I get you, before I do that, can I just get you sitting up straight so I can just do it, so it's easier for me to do a proper assessment on you? Cool. And is that comfortable for you? Yeah. Okay, and before I start, do you have any pain anywhere?
No.
No pain? Okay, cool.
Just a bit of tightness.
Yeah. Okay, well, we'll check that out. So at the beginning of this assessment, I introduced myself. I told Jess that I was a student paramedic. I also got her name and her age and also some other details. I let her know that I was going to do a respiratory assessment on her, and I also got her consent, letting me be able to do this on her. And I also found out her chief complaint, which was her chest being quite tight. Okay, so I'm just looking around and I don't see any medication or any ventilators or oxygen bottles or oxygen tubing. Do you have any of those? No, you don't? Are you short of breath at the moment?
No, not at the moment.
No, not at the moment?
I was earlier before, but not now.
Okay, how long ago was that?
About 20 minutes ago.
About 20 minutes ago, and now you're feeling alright? Yeah. Cool. I'm just checking out your colour, and you've got a very nice colour to you, showing that your perfusion is going well. And you're speaking full sentences to me, so it shows that you're not having any trouble with your breathing at the moment.
No, I'm not having any trouble.
Okay. I also asked Jess if she took anything for this, so if she had any ventilators for asthma, or if she had any oxygen or oxygen tubing for possible COPD. She said that she didn't have any. I also asked if she was short of breath, but at that time when I was assessing her, she wasn't. But before she was. She did have some shortness of breath, and I also checked her colour to see if it was her extremities were blue, but they weren't. She was a normal colour, she wasn't pale, and so that indicated that there was really good oxygen saturation within her blood going all around her whole body. I also asked if she was having any trouble breathing, but she managed to say full sentences to me as I was asking her questions. Alrighty, Jess, so when did this pain start?
Round about this morning when I went for a run.
Okay, so what provoked it? Did that provoke?
Yeah, I haven't been exercising in a while, and it kind of,
Okay, and what kind of, reduces your pain?
When I stop running, basically, yeah.
Okay, so with your pain, what type is it? Is it a cramping? Is it tightness? Is it a sharp pain?
It's more just tightness, really, like.
Okay. And is it central in the chest area, or is it across the whole of it, or does it go to your back at all?
It's just more across the whole front of my chest.
Okay. And with your pain, in regards to numbers, 10 being the worst and 0 being nothing at all, what would you rate your pain?
Now I'd probably rate it around about a 2.
Okay. And what is it like? Does it come in waves, or is it constant?
It was constant, but now that I've sort of tamed it down and sort of now not running anymore, it's sort of yeah.
So you've got tightness, you're not really short of breath, it's more just tightness all in your chest area.
Yeah.
Okay, do you have any allergies at all?
No.
No allergies, so no allergies to medicines at all?
No.
Do you take any medicines at all?
Besides the pill, no.
Okay. And do you have any past medical history?
No, not that I know of.
And when was your last meal? What time did you eat?
This morning I had breakfast.
Okay, so you haven't had lunch?
No.
Okay. And what were you doing prior to getting a tight chest?
I was running on the treadmill and I decided that it'd be really good to sort of run at a really, really fast pace, that I didn't really warm up.
Okay.
Cool.
That her chief complaint of tightness of her chest was from her doing exercise. So I asked her what provoked the tightness of her chest, and she said that it was the exercise, and that when she is relaxed and she's having breaths, that's when it subsides and doesn't get as bad. I also asked her what type of pain it was, like if it was a cramping sort of pain, a stabbing, or a tightness, and all she said was just a tightness in her chest. I also asked if it radiated to her back or if it was anywhere else in her body, but she said that it was more centralised to her chest. I also asked her how, in a scale of 0 to 10, with her pain. She said it was a 2, so showing that it's not that painful. And I also asked if it came in waves or if it was a continuous sort of pain, and she said it was a continuous sort of pain. So I also asked her if she had any allergies to any medicines, which she didn't, and if she was taking any medicines. She was only taking her contraceptive pill. I asked her if she had any previous history with regards to chest tightness, and she said that she didn't have any. I also asked her when was the last time she ate, and she said it was about breakfast time. So I was making sure to get every little bit to see what could have possibly been the initial cause of the chest tightness, and if there was anything with regards to medical history that could be an underlying factor to this chest tightness.
Just before I inspect your chest area and your neck, I'm just going to put my gloves on. Okay.
At the beginning of the assessment, you could see that I didn't have any gloves on. This is because I was only questioning her and talking to the patient, so I wasn't having any physical contact with her. However, I did put my gloves on because I knew that I was going to do a physical examination of Jess involving me touching her body and her chest area, and which I asked for her consent, which she gave me, so I was able to do that. So I just put my gloves on so that it was a safety barrier between me and my patient.
Okay, Jess, so now what I'm going to do, is it alright if I touch you? Because I just want to inspect your head and your neck and your chest.
Yeah, sure.
Okay, so just checking. So you've got no pain at all on your neck?
No.
No pain when I touch your head at all?
No.
Okay. And here, no pain?
No.
Because what I want you to do, I'm just going to grab here and here.
Mhm.
I just want you to breathe in and breathe out so I can just check your chest. Okay, so do a deep breath in for me and out. Oh. And again. Okay, so you've got equal chest rise and fall, which is great. I'm just going to check your skin and just feeling that you're nice and warm, good temperature when I'm touching you. And can I just get you to swivel a little bit so I can just check your back as well? So I'm just going to, just tell me if there's any pain while I run my hands down your back.
Yep.
So I'm just feeling, just checking. No pain at all?
No.
Okay, sweet as. No pain. Cool.
When I was doing my survey on Jess, I made sure that I had her consent so that I was allowed to touch her head and her neck and her back and her chest area. I was doing this to make sure if there was any other pain that she was feeling that I was able to find it. So I felt her head and her neck and her back and also her chest. She didn't have any pain. What I also did was I checked underneath her armpits and just where her abdomen is and asked her to take deep breaths in and out, and I was feeling for equal chest rise and fall, telling me that she was getting good air and equal air entry into her lungs, and that she didn't, and I couldn't feel any abnormalities or lumps or a possible injury that she could have sustained while also doing the exercise on her head or her neck, which is a good sign. So all that I need to worry about is why her chest is quite tight at the moment.
Okay, Jess, so now what I'm going to do is I'm just going to auscultate and listen to the 4 quadrants of your lungs. So I'm going to do your front and your back as well. So I'm just going to listen to your breathing when you breathe in and out, and your vocal noises as well.
Yeah.
Okay?
Yeah.
So is that alright?
Yeah.
Alright. So I'm just going to listen to up here. Just pop it on your chest.
Cool.
So can you just do a big deep breath in for me and out. Cool. Go this side. And I'm just going to reach underneath your top if that's alright.
Yeah.
And the other side. Okay, so can you just swivel from me a little bit so I can listen to the back? Okay. So again, just going up from underneath. And while you do this, just do some, just chat, say something.
Okay. Yeah.
Yeah.
Sweet.
again. Last one. Okay, so I can hear equal air entry, and also your vocal your vocals are really good as well, so nothing to worry about there.
I was auscultating Jess. I made sure that I had her consent so that I could listen to the back and front of the 4 quadrants of her lungs. I was listening to her breathing and also her vocal resonance, and making sure that there was equal air entry into both of her lungs. So when I was listening, I didn't hear any abnormal noises like a wheeze or crackles, which could indicate narrowed or inflamed airways or possible asthma or pneumonia or fluid in the lungs. I made sure to listen to the back and the front of the 4 quadrants so that I had a larger area that I was assessing, so that there was no possibility for me to miss any abnormal sounds or anything that I could hear. Her breathing was fine. I just heard normal air entry into all the 4 quadrants in both her lungs, and I also was listening to her vocal resonance, so I made her say a few words while I was listening to her lungs, and they sounded perfectly fine.
Okay, Jess, now what I'm going to do is I'm just going to palpate, so I'm just going to touch your chest and also just check your ribs as well for any crepitus or any lumps.
Yeah.
Is that alright?
Yeah.
Okay, so I'm just going to feel up here. So I don't feel anything abnormal. And I'm just going to feel here as well. That's alright?
Yeah.
So I'm just going to squeeze a little bit. So I don't feel any crepitus, which would be a crunching noise, which is good. And I don't feel any lumps or any deformities anywhere. Okay. Cool. You're all good.
You're palpating your patient, you also need to get consent. So again, I got consent from Jess, and what this allows me to do, it allows me to feel her chest area and also the sides of her rib cage for any abnormalities or any lumps or deformities that could possibly be there. I made sure that I felt the sides of her chest for any for equal expansion on both sides, and also I was feeling for any crepitus, which is like a crackling, crunching sort of noise, which I didn't feel when I was palpating Jess's rib cage. I also couldn't feel any abnormalities when I palpated up here, so I was just going to see if there was anything else, which I couldn't find, which is good, so that she had no abnormalities while I was palpating her.
Okay, Jess, so now what I'm going to do is I'm just going to do some percussion, and I'm going to listen to your clavicle, which is your collarbone, and also just some of the sides of your chest as well, and also your chest wall, so that meaning I'll be touching it in the middle here. Is that alright?
Yeah.
Okay. Cool. I'm just going to do the middle. Is that alright? And just the sides, I'll do both. Just underneath your armpit.
Yeah.
So what I was listening for was any hollow sounds or any dullness, but I didn't hear any of that. I just heard normal percussion sounds, which means everything is all good.
Seeing a patient, you need to make sure that you get their consent. I got consent from Jess, so I was able to do percussion on her clavicle. I also did it on her sternum, and I also did it on her rib cage. What I was doing was I was listening to any sounds that could possibly not be picked up while auscultating. I was listening for resonant and or flat sounds, which are normal, which you usually hear when you're doing it on bone or normal lung tissue. I was also listening for dull, hyperresonant and sympathetic sounds, which could possibly indicate fluid or solid tissue or excessive air within the lungs, which could indicate COPD or asthma or pneumonia or possible tumours within the lungs, which are abnormal. However, I only heard the normal sounds when I was percussing Jess, so there were no abnormalities that I needed to worry about. Jess presented with a tight chest, and she said that she had been running prior to this. that is when she got a tight chest. She said that she was short of breath after she stopped running, but she had normal breathing when I was there, so it had subsided over time, which is good. Jess, also, she could have possibly been presenting with asthma. However, I did ask her if she had any ventilators or any medication to help with a condition such as asthma, but she didn't have any. And she also, when I was auscultating her lungs, I couldn't hear any wheezes or any abnormal sounds, and she was only short of breath for a short period of time. She could have also been presenting with bronchiolitis, but again, when I auscultated her chest, I didn't hear any abnormal sounds like wheezes or crackles, but she only had a tight chest, which she was presenting with from the onset. She also could have been presenting with pneumonia. However, she had no cough, and she also didn't have a fever or chills, because I did feel her skin and her temperature felt normal to me. She wasn't too hot, she wasn't too cold. Also, her colour was nice and pink and rosy, and she wasn't pale. Again, I didn't hear any wheezes while I was auscultating her, and she had no prior past medical history that could indicate that she could possibly have one of these conditions. So what I was thinking is she could have just pulled a muscle while she was running, because she did say that she hadn't exercised for a while, for a long period of time, and she decided to do a more intense workout when she was running. So she possibly could have been breathing quite fast while she was doing this, as she was trying to get more oxygen into her lungs, which could have caused the tightness in her chest, as she is not used to doing an intense pace as to what she was doing today. She also said that her pain scale was a 2, so it wasn't a very painful thing for her. It was probably just quite an annoyance, and which she could have been feeling. So what I was gonna do, I was gonna get all of Jess's details, so her name, her number, where she lived, and her age, and also from the findings from the assessment that I did, I would make sure they're all documented and down on a piece of paper or on the EPRF. What I would also do to Jess is I would inform her on alternative treatments, or if she could go to a GP, or if she could go to the White Cross, rather than going to the hospital, as she is not really presenting with anything extreme. Yes, it is a tightness of chest, but she only had shortness of breath for a short period after exercising. She has I was listening to her lungs, she had no abnormal sounds which I could hear. She has equal air entry and chest rise and fall. She also has no trouble speaking full sentences to me, showing that she's not having any trouble with her breathing. She was also quite calm when I got to her as well. But there is still the option of going to hospital if she wants to go. That is an option, but it's whether she chooses to go to hospital or go to the GP or to a White Cross to just figure out and get some treatment for her tightness of chest, which is her chief complaint.